In this video, we're going to explore 12 unusual indicators that could point toward liver damage. Recognizing these signals early is absolutely vital, as it empowers you to take proactive measures to halt the condition from advancing further. The liver possesses a remarkable capacity to regenerate and heal itself, provided it is given the proper care and attention. Statistics from the American Liver Foundation reveal a startling fact. 1 in 4 adults in the United States is impacted by liver disease. Contrary to popular belief, overconsumption of alcohol is not the sole culprit behind liver damage. A number of other factors can also contribute to liver impairment, including a diet high in processed foods, excessive intake of sugar and industrial seed oils, overuse of pain-relieving medications, and infections from various viruses. If you're interested in learning whether your body might be signaling liver troubles, be sure to watch this video all the way to the end. We will also be covering several natural, home-based treatments you can use to cleanse your liver and protect it from additional harm. Number 1. Pale, colored stool. Pale stool can serve as a significant warning sign of potential liver damage. When we consume food, our liver produces bile, a substance essential for digesting foods and the fats within them. This bile is what gives your stool its characteristic brown hue. However, if you have a damaged or fatty liver, it can obstruct the normal flow of bile through the bile ducts. This disruption alters the stool's color, causing it to appear lighter, paler, or even clay-colored. Furthermore, due to the improper digestion of fats, your stools may become unusually buoyant, causing them to float on the water's surface in the toilet. It is crucial not to dismiss these signs. Consult a healthcare provider at your earliest opportunity. Number 2. Nyctalopia. Poor night vision, medically termed nyctalopia, can be another indicator of a compromised liver. This is a condition where a person finds it difficult to see clearly in dim light or darkness. As we know, the liver's job is to filter out toxins and synthesize various proteins, including one known as retinol binding protein, which is responsible for transporting vitamin A to the retina. When the liver is impaired, it can result in a vitamin A deficiency. This deficiency directly impacts the specialized cells within the retina that are responsible for vision in low light conditions. If you are experiencing a noticeable decline in your night vision, it is important to see a doctor, as it may be pointing toward liver damage. Number 3. A swollen right foot. Liver damage can lead to a condition known as peripheral edema, which involves the swelling of tissues, typically in the legs and feet. When the liver is harmed, it may become unable to generate sufficient amounts of albumin, a crucial protein that helps maintain proper fluid balance throughout the body. This imbalance can cause fluid to seep out and accumulate in the lower extremities, resulting in noticeably swollen feet. This swelling is often more pronounced on the right side due to the specific pathways of blood flow through the body. Before we move on, if you're finding this video informative so far, please make sure to subscribe to our channel. By subscribing, you'll never miss any of our latest health insights and updates. Number 4. White or yellow bumps around the eyelids. Another peculiar sign of potential liver trouble is the appearance of white or yellowish growths in the skin around your eyelids. These small, packet-like bumps are actually deposits of cholesterol called xanthelasma. When an individual has a liver condition, the organ may lose its ability to properly break down cholesterol. Consequently, cholesterol begins to accumulate in various parts of the body, including the delicate skin of the eyelids. The presence of xanthelasma could be a marker of underlying liver disease, so please do not overlook it and consider scheduling a liver checkup promptly. Number 5. Right-sided pressure. A noteworthy sensation that can indicate potential liver disease is a feeling of pressure or discomfort beneath the right side of your rib cage, particularly after eating. Essentially, the bile produced by your liver can become thick and sludgy when the liver is damaged. This sludge can then block the small ducts that connect to your gallbladder. This backup creates pressure against your ribs and can even irritate your phrenic nerve, leading to referred muscle tightness and discomfort in your right shoulder. It's essential to recognize these bodily sensations as possible signs of liver problems so you can seek professional help before the situation worsens. Ours number 6. Purple or red bumps on the skin. According to medical science, a damaged liver may become unable to produce sufficient quantities of certain proteins, such as fibrinogen. Fibrinogen is a key component of the coagulation cascade, which is the process essential for proper blood clotting. This impairment means you may bruise with unusual ease and frequency, which can manifest as unexplained purple and red spots or bumps appearing as a rash on the skin. These discolorations are most commonly observed around the lower legs and arms. Sometimes, they are also caused by poor blood circulation, which is itself another sign associated with liver disease. Number 7. Cracked heels. Cracked heels can be a surprising sign of a damaged liver. Our body utilizes vitamin B3, also known as niacin, to keep our skin hydrated, smooth, and resilient, thereby protecting it from damage. However, when our liver is impaired, it will consume all of its stored vitamin B3 in a desperate attempt to repair its own tissues. This resulting deficiency of vitamin B3 leads to dryness and severe cracking of the feet, particularly the heels and soles. Do not ignore this seemingly minor sign, as it could be your body's way of indicating a stressed liver. As number 8. White or swollen nails. Nails that appear unusually white or swollen could point towards serious liver damage or another underlying health issue that compromises the oxygen supply to the nail beds. A landmark study conducted in the 1950s revealed that 8 out of 10 individuals with severe liver scarring had completely white nails, demonstrating a powerful correlation between nail appearance and liver health. Additionally, clubbed nails, characterized by rounded and enlarged fingertips, may also be a sign of chronic hypoxia, a condition often associated with advanced liver diseases like cirrhosis. Monitoring changes in your nail's appearance, especially when combined with other symptoms, can be instrumental in the early detection of liver-related problems. As number 9. Dark urine. If the color of your urine is persistently dark yellow or brown, it is a classic symptom that your liver may be damaged. The liver plays a vital role in filtering and processing waste products from the blood, including bilirubin, a yellow pigment that is a normal byproduct of red blood cell breakdown and gives urine its characteristic color. When the liver is damaged, it loses its ability to filter bilirubin effectively, causing this pigment to build up in the body. This excess bilirubin is then excreted through the kidneys, giving the urine a noticeably darker hue. This can be a sign of various liver conditions, including hepatitis, cirrhosis, or even liver cancer. As in number 10. Jaundice. Jaundice is a significant and well-known symptom of a fatty or otherwise damaged liver. Jaundice occurs when there is an excessive accumulation of bilirubin in the bloodstream. In a healthy, functioning liver, bilirubin is efficiently processed and excreted. However, when the liver becomes compromised, such as by significant fat accumulation, its ability to process bilirubin is severely impaired. This leads to a buildup of the pigment throughout the body. This accumulation causes a distinct yellowing of the skin, the whites of the eyes, and the mucous membranes, giving rise to the characteristic symptom we know as jaundice. Ours number 11. Spider veins. Spider veins, also known medically as telangiectasias, are small, dilated blood vessels that become visible close to the surface of the skin. They often form a web-like or spider-like network of red, blue, or purple lines, which is how they earned their common name. These veins are commonly found on the face, legs, and feet, and their presence may indicate an underlying liver condition. When the liver is damaged, it can fail to properly metabolize hormones like estrogen, leading to elevated levels. This can result in increased pressure within the veins, causing them to dilate and become visible. Spider veins can also be a sign of other serious liver conditions, such as cirrhosis or hepatitis. Or number 12. Itchy skin. Unexplained, persistent itchy skin is a common symptom associated with liver damage. This uncomfortable condition is primarily caused by a buildup of bile acids underneath the skin because the liver is not filtering them out of the blood properly. This accumulation causes histamines to be released into the bloodstream, which triggers the itchy sensation. This can also lead to dry, flaky skin, which only contributes further to the overall feeling of itchiness. If you are experiencing any of the 12 symptoms we have mentioned above, you may want to schedule a visit with your doctor and request an examination of your liver, typically via an ultrasound test, to determine if damage is present. How can we reverse liver damage? Liver damage typically progresses through 4 distinct stages. Initially, excess fat builds up within the liver cells, which then leads to inflammation and the subsequent development of scar tissue, a condition known as fibrosis. If the process is not halted at this stage, it can advance to permanent scarring of the liver, also known as cirrhosis. Cirrhosis is the most dangerous stage and can ultimately result in complete liver failure. Fortunately, the liver has a phenomenal ability to completely heal and regenerate itself with a dedicated approach to diet and other supportive remedies. So, let's delve into the most important steps you can take to actively heal your liver. First, consider starting your day by drinking organic coffee. Instead of adding sugar, mix in half a teaspoon of turmeric. The powerful phytonutrients in turmeric, combined with beneficial compounds in coffee, help reduce the formation of scar tissue and repair damage caused by substances like drugs, alcohol, and fructose. Furthermore, drinking at least 1 liter of pure water daily can help thin the blood and aid the liver in producing adequate bile to break down stubborn fatty deposits. It is highly recommended that you incorporate as many liver-cleansing herbs and spices into your daily diet as possible. Excellent choices include ginger, turmeric, cinnamon, dandelion root, milk thistle, reishi mushrooms, green tea, and cloves. Second, to significantly improve your liver health, it is critically important to eliminate inflammatory seed oils from your diet entirely. These include corn oil, cottonseed oil, canola oil, rapeseed oil, soy oil, margarine, and low-quality, processed olive oil. These industrial oils can contribute directly to liver inflammation and ongoing damage. You can replace them with anti-inflammatory, healthy fats like butter, tallow, extra virgin olive oil, and coconut oil in your home-cooked meals. These healthier alternatives not only enhance the flavor of your dishes dramatically, but also provide proven liver protective properties. Third, make a conscious effort to incorporate sulfur-rich foods into your regular diet. Focus on consuming leafy greens, arugula, radishes, garlic, broccoli, Brussels sprouts, kale, cabbage, mushrooms, pastured eggs, fish, walnuts, onions, scallions, and broccoli sprouts. These foods are exceptional because they help elevate your body's glutathione levels, a master antioxidant that is crucial for liver detoxification and the removal of fat. Their high sulfur content actively supports the liver's complex pathways for breaking down toxins, thereby promoting overall liver health and optimal function. Regular consumption of these nutrient-dense options is a powerful strategy for combating fatty liver disease and enhancing your body's innate detoxification processes. Fourth, you must stop eating processed and sugary foods. In order to genuinely reverse liver damage, it is imperative that you drastically cut back on sugary, starchy, and flour-based foods. This category includes bread, biscuits, sweets, ketchup, pancakes, pasta, soda drinks, and similar items. A fatty or damaged liver is sensitive to fructose, or fruit sugar, in a manner strikingly similar to its sensitivity to alcohol. Therefore, it is also very important to stop drinking fruit juices and alcoholic beverages entirely. This is the foundational starting point for embarking on the journey of curing your liver. Fifth, to effectively lower inflammation and cleanse fatty deposits from inside the liver, you can consider taking purified bile salt supplements. These can include products like 2-DCA, purified bile salts, or digestive enzymes that contain ox bile. These supplements are particularly potent when taken first thing in the morning on an empty stomach and can be very effective at eliminating fat from the liver and preventing the formation of gallstones. Consulting with a qualified healthcare professional can help you determine the most appropriate supplements and dosages for your individual liver health needs. Sixth, the practice of intermittent fasting is a remarkably effective way to give your liver a much-needed break and maintain its long-term health. This eating pattern helps reduce liver fat, improves insulin sensitivity, and lowers overall systemic inflammation. Furthermore, it triggers a deep cellular cleansing process known as autophagy, which helps clear out damaged cells and other detrimental substances that have accumulated within your liver.